Hi everyone, so today we're going to be talking about kidney stones. The chief complaint is, I am experiencing a sharp pain in my right side and lower back below my ribs. It also burns when I am urinating. The subjective. A 40-year-old woman comes into the office complaining about a sharp pain on her right side and lower back. She is with her husband and says she has been experiencing the pain for over 24 hours. The pain usually comes in waves and lasts for 20 minutes to an hour. She has an increased urge to pee, but is unable to due to excruciating pain. She also feels nauseous, has chills, and is on the verge of vomiting. On a scale of 1 to 10, she rates her pain a 9 and says, I've never felt so much pain. She explains how the pain has stayed in one place and she uses a heating pad to relieve the pain. The patient does not have a medical history and is not currently taking any medications. The patient's history. Her medical history is she doesn't have any. She's currently not taking any medications for an illness. Her social history includes she lives with her husband, 2 daughters, and her family history includes her mother battling breast cancer in the early 2000s but recovering, and her father currently battling diabetes and dementia. Today, my discussion question is, based on the patient's pain in her right side and lower back, where is the irritation/blockage occurring? A, the liver, B, the adrenal glands, C, the kidneys, or D, the ureter. So I'll give you guys a second and we'll move on. So the answer is C. The patient's pain in her right side lower back is indicative of an irritation or blockage occurring in her kidneys. And the kidneys sit in kind of like the middle of your body, right in the, but more towards the posterior side, and they're very indicative of kidney stones. And then you'll feel pain in your back as opposed to like in your stomach or like the front of your body. So definition of the kidney stones is that they are small, hard deposits of minerals that clump together and pass painfully through the ureter and bladder. They're also referred to as nephrolithiasis, urinary stones, and renal calculus or calculi. The prefix suffix associations for nephrolithiasis are prefix nephro refers to kidneys, lith refers to stone or rock, and the suffix iasis refers to abnormal condition. So here's a further description of kidney stones. As you can see, the 3 terms that they're also used to refer to kidney stones: nephrolithiasis, urolithiasis, and renal calculi or calculus. And those are for kidney stones. This is what is included in the cycle of kidney stones. Starts in the kidneys, moves to the ureter, goes to the bladder, and then the urethra where you urinate. And it appears when solutes in the urine precipitate and crystallize, and depending on which solute precipitates, is indicative of what stone is going to be created. So you can either have a calcium oxalate, calcium phosphate, uric acid, cysteine, or struvite stone. So kidney stone symptoms, they can be described as being the size of a grain of sand or also as large as a pebble. And as you can see on the image on the right, the stones on the left are a little bit more pebble size, and then the ones on the top right are broken up and more grain of sand size. And pain begins when the kidney stones cause irritation or a blockage, and many stones pass without damage, but they are accompanied by excruciating pain. And these symptoms would include severe pain on either side of the lower back, pain near the stomach, blood in the urine, nausea, vomiting, fever, chills, a burning sensation while urinating, and urine that smells bad or is cloudy. So now we're gonna watch a quick little video just for a minute or so. That'll go a little bit deeper into what kidney stones are and where they are in the body.
Kidney stones are hard stone-like lumps that can form in your urine. They are common and occur twice as often in men as women. Let's look inside the body to see how the kidneys work. The kidneys are 2 bean-shaped organs located near the middle of your back. They work as a filter, removing waste products and excess fluid from the blood, and returning clean blood to the body. The waste products and excess fluid become urine. It travels through 2 narrow tubes, called the ureters, to the bladder, and leaves the body through the urethra. If there is an imbalance in the waste chemicals in the urine, crystals can form, which may build up into stone-like lumps. These are known as kidney stones. This can happen for a number of reasons, including not drinking enough water, a diet high in protein, or health conditions such as kidney disease. If kidney stones are small, they usually leave the body when you pass urine. However, larger stones can get stuck in the kidneys or pass down the ureter, causing irritation and blocking the flow of urine. This often results in an infection and intense pain that is felt in your back.
All right, so we're going to go back to the PowerPoint. So during a physical examination, the doctor will often ask, take the patient's temperature, check the patient's weight, press lightly on the abdomen or back to identify fluid buildup or pain, listen for bowel sounds, which are indicative of kidney stones, and check for enlarged lymph nodes in the groin. They'll also ask about medical conditions, asking what you've had in the past, or because they want to see if you're more susceptible to kidney stones. And if you've had medical conditions such as gout, frequent UTIs, or urinary system abnormalities, you are more susceptible to kidney stones. They'll also ask lifestyle questions such as what fluids do you drink, how much you drink, do you drink grapefruit juice, because that can also cause kidney stones, unfortunately, how active you are, does your job require you to be active, are you sitting throughout the day, and what type of foods do you eat. And then based off those questions, the doctor will be able to find results and determine if the patient has kidney stones and if they will continue to have them. So possible treatments, there are non-surgical and surgical kidney stone removal. Non-surgical kidney stone removal includes lithotripsy, which is shock waves that are put towards the body, breaks stones into smaller pieces, and then they're able to pass through the urine. As you can see on the image on the right, there's the shock waves currently being generated, and kidney stones are being broken up. You can also do pain relievers such as ibuprofen and acetaminophen. You can do medication, which includes alpha blockers to help relax the muscles in the ureter. And you can increase your fluid intake, which with increased amounts of water will allow the stones to be flushed out through the urinary tract. Moving on to surgical kidney stone removal, there is percutaneous nephrolithotomy, which is a procedure using a nephroscope to locate and remove kidney stones. The doctor usually will insert the tool into the kidneys through a small cut made in the back. And then larger kidney stones would require lasers to break them down into smaller pieces, and anesthesia is often accompanied with that. You can also use cystoscopy and ureteroscopy for surgical kidney stone removal. During cystoscopy, a cystoscope is used to look inside the urethra and bladder. And then during ureteroscopy, the doctor uses a ureteroscope to see detailed images of the ureters and kidneys. And then once the stone is found, it can be broken up and removed. There are two imaging tests that can be used for kidney stones. The first one is a CT scan, which is a series of X-ray images taken at different angles using a computer, and it creates cross-sectional images of the bones, blood vessels, and soft tissues in the body. You can also use an ultrasound, which is the image on the right, and that is an imaging method that uses sound waves to produce images of structures within the body. And ultrasounds are often used to detect cysts and tumors, obstructions, or infections within or surrounding the kidneys. So it can be used to indicate if kidney stones are present. And kidney stone treatments include, for small stones with minimal symptoms, you can use medical therapy to help pass the kidney stone. This includes medications such as an alpha blocker or pain relievers, which relaxes the muscles in the ureter and helps pass the kidney stone more quickly. But for larger stones, scopes can be used to remove the stones. This includes shockwave, lithotripsy, nephrolithotomy, ureteroscopy, and parathyroid gland surgery. And multiple treatments do exist, but just depending on the size and cause of the stone, you're going to use different treatment methods. And they all function to break the stones down and then allow them to pass through the urinary tract. So that's the end goal. And as you can see in this image, it describes how kidney stones that are too big to pass through, you use ultrasound shock waves to crush the stones, and then the smaller pieces are able to pass. And here are my references. Thank you.